Liver ultrasound findings. On ultrasound, the liver is usually examined in the right upper quadrant beneath the diaphragm. A normal liver has a smooth capsule, homogeneous echo texture, and medium-level echogenicity slightly greater than the renal cortex. The liver size should not exceed 15 to 16 centimeters. Important structures visualized include the hepatic veins, portal vein with echogenic walls, and intrahepatic biliary channels. Ultrasound can detect diffuse pathologies such as fatty infiltration, increased echogenicity, cirrhosis, irregular surface, coarse echo texture, and nodularity, and focal lesions like hemangiomas, metastases, or hepatocellular carcinoma. Kidneys ultrasound findings. Both kidneys are visualized in the lumbar region, with the right kidney adjacent to the liver and the left kidney adjacent to the spleen. The renal cortex is hypoechoic compared to the liver and spleen, and the central sinus appears echogenic due to fat and vessels. Normal adult kidney length is approximately 9 to 12 centimeters. Ultrasound is valuable in detecting hydronephrosis, renal cysts, calculi, pyelonephritis, and chronic renal parenchymal disease, which may show cortical thinning, increased echogenicity, and loss of corticomedullary differentiation. Gallbladder ultrasound findings. Located beneath the liver, the gallbladder appears as a pear-shaped anechoic structure with thin echogenic walls. Its normal wall thickness is less than 3 millimeters. Ultrasound effectively detects gallstones echogenic foci with posterior acoustic shadowing and gallbladder sludge low-level echoes without shadowing. In acute cholecystitis, the wall is thickened, pericholecystic fluid may be present, and a positive sonographic polyps. And carcinoma of the gallbladder can also be identified as intraluminal masses. Spleen ultrasound findings. The spleen is visualized in the left hypochondrium, normally measuring less than 12 centimeters in length. Its echo texture is homogeneous and slightly more echogenic than the liver and renal cortex. Urinary bladder ultrasound findings. The bladder is best assessed when adequately distended, appearing as an anechoic structure with thin, regular echogenic walls. Pathological findings include bladder calculi echogenic foci with shadowing, bladder wall thickening, trabeculation due to chronic obstruction, diverticula, and tumors, which may appear as irregular echogenic masses projecting into the lumen. Residual urine after voiding can also be measured to assess bladder function. Prostate ultrasound findings. The prostate is evaluated transabdominally with a filled bladder. Normally, it appears as a homogeneous gland with medium-level echogenicity, located inferior to the bladder. The normal volume is less than 30 milliliters. Benign prostatic hyperplasia. BPH is seen as a symmetrically enlarged gland, causing indentation of the bladder base and sometimes residual urine. Prostate carcinoma may present as a focal hypoechoic lesion.